hasn't lost any.
Hello. All right. We are getting ready to go today. I know I'm a little later than we usually are, so thank you for joining in. All right. So today I'm going to continue the talk about fertility. So I thought it was awesome to go through and do the live last Friday. That was a lot of fun. And then yesterday we did a whole series on and talk about the importance of fertility and infertility and the pelvic floor. So how it all relates together. So if you are hoping to be pregnant or thinking about getting pregnant at least in the next year, or if you are struggling with infertility. Yesterday's episode was awesome and really talks about some holistic natural ways without running to a reproductive medicine doctor, or if you already have, exhausted what you think are all your tools for holistically getting pregnant. I talk a lot about some other ways that we can help. So I hope that you will go check that out and really empower yourself to add that to your toolbox if you are in fact dealing with infertility. I mentioned yesterday that infertility in the United States is diagnosed after you have been trying to conceive and not successfully conceive over a year. And so if it's been longer than a year, even if it hasn't, no matter what, send it to any of your friends that are trying to get knocked up. Honestly, it is going to be helpful for them in their journey, and you never know what someone is going through. So the more you share this information, the more that people are going to find out about it, the more that they'll seek help and hopefully avoid a lot of invasive procedures that might not need to happen and can possibly save them a lot of money in the long run. So, not to mention all the amazing effects that pelvic floor therapy can have on the body in preparation for pregnancy to help prepare for birth, and then therefore have a lot less trauma in when you do birth. So therefore, the recovery postpartum is a whole lot easier. So check out that episode today. It'll be brief. We're not going to be here long, but I do think it's important, and I really want to discuss the importance of what we're seeing clinically. And so I thought I would share a few success stories about the fertility journey and some of our clients who have conceived successfully after either having some diagnosis, whether that be PCOS or endometriosis, even vaginismus, so spasms of the pelvic floor, and having painful intercourse, and then those patients getting pregnant and conceiving and having healthy, happy babies. So I'm going to share a couple success stories, and then I want to dive into some really important clinical correlations that we see. So again, this is not found in the research. People aren't researching this stuff, unfortunately, but it is. This glare is intense. So hopefully you can see me okay. Let's see if I do here. That's going to block that, but whatever. There we go. And then some really important clinical correlations I just want to speak to. And I think it's important to note so you can really, if you know people that have gone through IVF, IUI, or have done some other fertility treatments, it's just important to know really what we're seeing in clinic. So I'm going to share that with you. And I think it can help save a lot of people, a lot of potential birth trauma and recovery postpartum. So we're going to talk all about that today. First, I'm going to just talk about, I'll just do a confidential story without naming names, but super exciting person who came to us, and she was unable to have intercourse but wanted to be pregnant. And so she found us through her doctor and was referred, and we were able to start helping her. Actually, there was a few things we helped her with before her sessions even started. And a lot of that was just some breathing and relaxation techniques, and then also gave her a few tools to start before she even started with sessions with us here at Body Motion Physical Therapy. I forgot to mention, I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, and we're located in downtown Edmonds, Washington. But if you're watching this, you might already know that, so thank you. And so I thought, I just thought I would share her story. So she comes to us. She had never had intercourse before. And when she attempted to start with her husband after they were married, she was you know, rudely awakened to the fact that, like, hey, this is not okay. This doesn't work for my body. What is wrong with me? And that is a really, really common place to be. A lot of people are like, what is wrong with me if intercourse isn't happening for them or if it's uncomfortable? And they automatically think like something is wrong with me, something is broken, or they fear that something's wrong with them. And that is totally a valid place to be because you're taught your whole life that this that you've never had before is supposed to be like magical and amazing. And then here you are suffering and like barely able to participate if you're able to participate at all. And so with her desire was like, I need to be able to have intercourse with my husband. I would love to enjoy it, but she was kind of even over that. She was like, if that ever happens for me, great. I would love that. But she didn't even think that was possible. She really truly just wanted to conceive the baby. And so she started working with us and we were able to get her to a point where she could tolerate penetration and then got to a point where it actually started to feel good, and she was able to fully participate. And then she was able to conceive her baby and they had a nice pregnancy and they're still pregnant. So that has been a really fun story for us. So I just thought that and now we're working through her birth prep and really preparing her for the delivery that she's wanting. She's wanting to have a medicated birth, but really be able to control her pushing and hopefully control her positioning as well for that birth. So we work a lot on the pelvic floor throughout the pregnancy. We work a lot on the external pelvis through the pregnancy to continue her progress and make sure that she doesn't regress, but also help open the pelvis so she'll be ready to birth that baby. So that's been a ton of fun working with her. Another person that I want to I'll tell you about had been through multiple rounds of IUI. This was actually her second baby. So she had already had a baby, but then had 5 years of infertility. So they had been trying for 5 years. So at this point, the baby was already seven. So their kid was already seven. And when I started working with her, so it was 5 years of actively trying. And so that's called secondary infertility. So if you're unable to conceive a second time, even though it was a easy breezy the first time, then that's called secondary infertility. So this couple had gone through rounds of unsuccessful IUI, rounds of unsuccessful IVF. This woman had also already had pelvic floor therapy. So she was like, I'm fine down there and, whatever. And then kind of decides like, okay, I'm going to go to someone who actually specializes with fertility, for infertility in regards to the pelvic floor. So she gave us a shot again, and it was the best thing that she ever did, in my biased opinion. But I would believe that she would also say the same thing. And so she came, and after believe it was 8 sessions, it might have been on week 6 though. So we did once a week for 6 weeks, I think. It was either 6 or 8, I can't even recall. And we worked through her pelvic floor. And so, yes, she had had pelvic floor physical therapy before. And yeah, they did some internal work, but they didn't work through all of her adhesions, all of her scar tissue in her pelvis. And she'd had a natural birth before, but she still had, and she didn't even have tearing, to be honest with you, but she had micro tears through her pelvic floor and trauma in her pelvic floor, carried a ton of tension in her pelvic floor. And she was, so we worked a lot through the pelvic floor and just opening it up, improving the flexibility, improving the coordination, really getting the quality of the tissue better. I kind of describe it as if your pelvic floor is really tight or if it's really tight or taut, you would decrease your blood flow and it becomes more dehydrated. Any muscle that's constantly contracted and not actively relaxing and contracting will become just tight, kind of fibrotic, if you will. I sometimes say it like turns into beef jerky, like that texture of beef jerky. And you can feel that within the pelvic floor. And so obviously beef jerky is not a healthy muscle. We want our muscles to be healthy and fatty. Like a chicken or a steak, like really nice musculature like that. And so I know the food analogy is kind of weird, especially in relation to the pelvic floor, but I do think it's a good analogy. And so if we can get the pelvic floor hydrated and healthy and happy like that, then we can really improve the success for fertility. And so with her, it was on week, I have to look back at my notes and I should have before this, but it was week 6 or 8. And she came back and she was pregnant and just didn't even want to think about it because in her SI was starting to hurt. So her sacroiliac joint, and she was like, maybe I'm pregnant. And then sure enough, the next week we're like, she conceived and she was pregnant. And that was without the IUI and IVF. So she had already gone through IUI, had done some unsuccessful IVF, and then was able to conceive naturally. And it was like, and that is just it's such a fun experience. She went on to have a beautiful baby boy and they lived happily ever after. No, she had a great birth. Really no trauma at all through her pelvic floor. And she recovered very, very nicely. I think she came in postpartum, really only for a few months because things felt so great and she was able to really get back to running as quickly as she wanted to. And so that was successful for her. So just a really fun stories. I could talk about these all day long because I love helping people get pregnant and it is just a ton of fun. And pelvic floor therapy has so much impact. Yesterday, I talked about the visceral motility and improving the visceral function and mobility. And we also talked about the importance of having a healthy and happy pelvic floor. One thing I just wanted to draw your attention to, and I started to make these notes last night as I was thinking about what I wanted to discuss today on the live. And so I was in bed and I was just thinking about, I want to share this clinical correlation that we see in the clinic. But I didn't want to share it at the same time because it's not research based. And I feel like that's not fair not to share research based information. But, I used to struggle with that a lot more. And now I don't as much because what we see clinically, we see thousands of people every single year. And it's like we have thousands of appointments. So and not thousands of people, but thousands of appointments. And every single year. And it's not, you know, it's just the impact is there, and we get to see the correlations between what people go through and their outcomes of the birthing process, of their postpartum recovery. I mean, we see it all. And so, regardless of whether some of this stuff is dictated or noted in the research, we see it clinically. And sometimes it's hard to capture what you see clinically in organized, evidence based research, randomized controlled clinical trials. And the reason for that is, I mean, you got to set these studies up, but it's hard to manage all the variables. Everyone is different. But I'm going to tell you something that we see that I think should be addressed. And I really wish it would be addressed, especially on the reproductive medicine side of things. I think it would be really helpful for people to know these correlations. Typically, what we see is people who have gone through IUI or IVF or have had issues getting pregnant. So, they've been on some kind of infertility journey. And when we see them postpartum, they tend to have had the most traumatic births or very traumatic births. Maybe not the most traumatic births, but traumatic births. No one who's ever gone through IUI or IVF has walked into our office postpartum and been like, I'm just here for prevention. I'm just here for recovery, yada, yada, yada. Usually it's like, I'm here. I pushed for 4 hours. It ended in emergency C-section. And I should look up there's got to be some research on IUI and IVF and reproductive treatments in correlation to C-sections. And I would imagine the C-section rates are higher. Now, some people who have those reproductive treatments also have higher risk for other things else, for other variables, and so therefore they might only be able to have a C-section. But I'm talking about people who have attempted vaginal delivery and then been able to then maybe had an emergency C-section. So those would be the people that we're looking at. And so what we see is that they tend to have a lot more trauma. And so I think we see that as a relationship. And I think that would be a huge benefit. So even if you were pregnant and you have conceived through IUI or IVF or any other reproductive measure, that you would seek out a pelvic floor therapist to really prepare your body before childbirth itself. And now, um, I just think that's underestimated. This goes for every single person, but specifically, if we could talk about like just that reproductive medicine part of things, so having some kind of difficulty conceiving, that is where we find so much birth trauma and so much relationship to potential C-sections. And so just something to know, something to tell your friend who maybe conceived through IUI and IVF. It's nothing to be embarrassed about whatsoever. I know a lot of people might keep that a secret. I think with social media, nowadays it tends to be a little bit more socially accepted that people conceive through other measures, and which is awesome because that's great. And I think that if we're open about that, it will just help us be open about getting people the right kind of treatment and what they need. So that is just one of the clinical correlations I really wanted to state and share, because that's not being shared in the research and people aren't talking about that. But we see this every single day in our clinic. And I think it's just an impact that, you know, if you were to conceive through some reproductive medicine, you would 100% benefit from going to see a pelvic expert PT and someone who does similar protocols to us during pregnancy, who really truly treats the pelvic floor, treats the pelvis and the body to prepare for the birthing process. Like we talked about in the pregnancy and birth episodes, you know, not all PT is created the equal. And just because someone's helping you through your pregnancy with your SI pain or your pubic symphysis pain doesn't mean that they know how to help you for the birthing process. And so you want to make sure that you're seeing someone that's going to help you really prepare for birth. So, and of course, if you don't have access to that, we do have an online birth prep program, which is great for anyone wanting to prepare their body and have the confidence to go into their birthing process, um, you know, without fear, really, and truly be in control of your own destiny. Now, of course, anything can happen, but we truly believe that like the more prepared you are, the better your outcome's going to be, the less trauma that you will have, emotional trauma, and less physical trauma as well, especially if you're prepared physically. So that's what I got for you today. Thanks for joining me. Take care, guys.